When there's a disaster and electronic records go down, how do you know if this person should take this medication or how they should take their medication? And so you're going to need someone to go over that with them and be able to relay information and evaluate whether certain therapies are adequate or necessary. Also, pharmacists are able to give immunizations as well. I've given many immunizations here in the past and recently, and so that may be a need at the time.
Today's our annual disaster training day for health and medical professions students in both SDSU and USD.
We have approximately 340 students today across multiple disciplines. When we initially started, we just had medical students. I believe there were secondary medical students, so we had about 50 students per class. And now it's become a yearly event, and we've now tied in a course called Core Disaster Life Support. That's half the day. The other half of the day is more hands-on training for possible deployment. A number of these students, and most years it's about a third, will sign up for ServSD, which is a program where these students, in case there was an influenza outbreak or something like that, where we need to have force extenders, where these students, these partially trained healthcare profession students, could then go back to their hometowns and help out the local providers.
A unique experience to have all these different disciplines of pharmacy, occupational therapy, PTs, medical students, what have you, to kind of be prepared for any disaster that would come up. So it's nice that we have that opportunity to participate before something like that would happen, and so that we're kind of ready for that event, and if anything would happen, we're actually able to be mobilized and useful.
The first part of the day for half of the students is what we call Core Disaster Life Support, and that's a national curriculum for health professions on disaster life support functions. And then the other half of the day is made up of a series of breakout sessions, and those are more specific to South Dakota issues that we want to train on. They range from psychological first aid to immunizations to anaphylaxis and the use of auto-injectors. We also have a session on triage, points of dispensing, and that's a mechanism where we plan and train to dispense pharmaceuticals or vaccinations to every man, woman, and child in the state within 48 hours.
Actually, Core Disaster Life Support is a course designed for all people that would be involved in a response to a disaster, people like emergency management, ICS type people. I think it'd also be a very good course for, like, say, the emergency managers at the county level to take it. If nothing else, then they'll know what those students that may be deployed back to their home counties, what the curriculum they've been through.
Mainly it's an awareness of the disaster response structure and then an ability above and beyond what they had when they came in today to assist in a response to a major disaster. As a medical profession student, they have skills above the rank and file person on the street, and with the guidance of a physician or the guidance of a nurse, they can extend those skills to a greater population in a disaster.
Department of Health, as the Emergency Support Function 8, that's the Public Health and Medical Support Function. We're the lead agency, and we've been working with hospitals, healthcare, EMS, local and state emergency management, even some of our federal partners at Health and Human Services to put together a medical surge plan so that if we have a mass casualty incident, we have the resources and the training and the communication, the plans, all those necessary elements to respond to that and to actually support the local organizations that are responding, that are dealing with that.
I'll tell you, there is one thing that's very interesting about it, is that it is a cooperation between the Department of Health, the state, the medical school, practicing physicians, the medical association. You don't get in very many states cooperation from everybody that is responsible for any kind of health care disaster management. So that makes our state of South Dakota special.